Welcome to Eurofins-Viracor Clinical Diagnostics Podcast, where I'll be sharing up-to-date scientific advances, key diagnostic testing, and our most recent innovations. Today is March 8th, 2021. In this episode, we're going to discuss solid organ transplantation and the use of FDA-approved Eurofins-Viracor ImmuKnow assay for non-invasive testing to screen for indicators of infection or transplanted tissue rejection. First, some statistics on solid organ transplantation. Based on 2019 data from the International Registry in Organ Donation and Transplantation, globally there were over 148,000 solid organ transplants performed, with around 41,500 in the U.S. alone. The Scientific Registry of Transplant Recipients 2018 data reports that since 2013 there has been rapid growth in overall numbers of solid organ transplants in the U.S. The most rapid increases have been in heart, 34.7%, lung, 31.7%, liver, 27.8%, and kidney transplants at 24.6%. The clinical challenge in organ transplantation is with controlling the levels of immunosuppression, meaning a need to balance the risk of oversuppression, which can lead to infection, malignancy, and drug toxicity, against the risks of undersuppression, which can lead to rejection. Every patient has a different balance point, and Eurofins-Viracor assays such as ImmuKnow, Viracor Track, TrueGraph, and therapeutic drug monitoring of anti-rejection drugs can help identify that point for each of your individual patients. Today we will be discussing the ImmuKnow cell function assay. ImmuKnow, the immune cell function assay, measures the concentration of ATP from circulating CD4 cells following their in vitro stimulation with phytohemagglutinin, PHA, as an indicator of immune cell function. This measurement is made of heparin anticoagulated whole blood using a luminometer and a fluorescent dye. The assay is used for the detection of cell-mediated immune CMI response in populations undergoing immunosuppressive therapy for organ transplant. CMI is mediated by T lymphocytes in the acquired immune response, monocytes in the innate immune response, and their effector interactions with other cells in the immune system. The measurement of CMI is valuable in a variety of applications, including transplantation. Traditionally, in vivo methods such as the skin test have been used to measure CMI, but there had been a need for in vitro methods to rapidly assess CMI. Current in vitro methods for assessing CMI include measuring cell activation signals, lymphoproliferation, cytotoxicity, and cytokine production. Most methods currently used for investigating immune function focus on lymphocytes. The patented ImmuKnow technology combines cell stimulation, cell selection, along with quantification of metabolic markers such as ATP, to measure the global cell-mediated immune response of CD4 cells. ImmuKnow measures the early response to stimulation by detecting intracellular ATP synthesis in CD4 cells selected from whole blood by monoclonal antibody-coated magnetic beads. The amount of ATP present in stimulated whole blood specimens is a measure of immune cell activity. Because the CD4 lymphocytes orchestrate CMI responses through immunoregulatory signaling, the measurement of CD4 activation reflects the degree of immune cell function. As response to immunosuppressive therapy varies among individuals, assessment of the patient's immune cell function may provide useful information to the clinician in the course of individual patient management. The ImmuKnow assay is best used to serially monitor a transplant patient. This test has been cleared for diagnostic use by the U.S. Food and Drug Administration. Here at Eurofins-Viracor, we offer testing to enable direct measurement of the immune system. The ImmuKnow assay allows for the identification of transplant recipients' immunological status or risk, the individualization of immunosuppressive therapies, monitoring the immune system response to therapy changes, and allowing for optimization of drug levels to achieve a lowest dose approach. A balancing of oversuppression, which can lead to infection, toxicity, or malignancy, with undersuppression can lead to rejection. As with other biomarkers, the results of ImmuKnow should be used in conjunction with clinical presentation, medical history, and other clinical indicators when establishing the immune status of a patient. ImmuKnow results may be unpredictable in some patients because of immune system instability caused by surgical trauma, anesthesia, transfusion, immunosuppression induction therapy, or lymphopenia, which is a very low CD4 T cell count. In the event that a procedure or therapy results in a very low CD4 T cell count in a patient, other cell types may be detected by the assay. The clinical implications of reactivity of these cells in the immunoassay have not been established. This is a qualitative assay. Therefore, the results do not quantify the level of immunosuppression. Special instructions are as follows. 2 to 3 milliliters whole blood collected and shipped in original sodium heparin green top collection tube. Using a provided shipping container, the sample is shipped at ambient temperature, priority overnight Monday through Friday. Specimen must be drawn after 4 a.m. Central Standard Time and shipped on the same day as collected to meet the 30-hour requirement. Samples should be shipped Monday through Friday, and Friday shipments must be labeled for Saturday delivery or specimens will not meet the 30-hour time requirement. All specimens must be labeled with the patient's name, collection date, and time. A Eurofins-Viracor test requisition form must accompany each specimen. Multiple tests can be run on one specimen. Ship specimens FedEx priority overnight. Causes for rejection: whole blood frozen, refrigerated, clotted, or received in transfer tube. Specimen will be rejected if greater than 30 hours old. Specimen type other than heparinized whole blood collected in sodium heparin tube. Turnaround time is 36 to 48 hours from receipt of specimen. Visit the links within this podcast summary for quick and easy access. Make sure to subscribe to this podcast and follow us on social media to stay up to date on all the latest information. If you want to help spread the word, please give us a 5-star review and tell your friends and colleagues to subscribe too. We're available on Apple Podcasts, Spotify, Google, Podbean, and more. With over 30 years of specialized expertise in infectious disease, immunology, and allergy testing for immunocompromised and critical patients, Eurofins-Viracor is committed to helping medical professionals, transplant teams, and reference labs get results faster when it matters most. Viracor is passionate about delivering value to our clients by providing timely, actionable information, never losing sight of the connection between the testing we perform and the patients you serve.